Welcome to the Friday Value video, and we are hopefully finishing up a series, Do You Have Lifelong Well-Being? And I provided a simple 7-question quiz, and I've really been rooting for you that you get 7 yeses. And we've been reviewing these particular special questions, some of which I have seen make a huge difference in people's risk of ending up in a nursing home, losing their independence, having a quality of life as they get older versus not. And we've gotten up to question number 6. Do you have good posture? Yes or no? Is your head on top of your shoulders? Now, last week we talked about if you can stand up without stiffness in your low back, and a lot of that has to do with causing poor posture. If you can't stand up straight because of pain, that's going to put that head in front of your body because you can't stand up straight. You're kind of bent here. But if you can't stand up straight after you loosen up, grease the wheels a little bit, motion is lotion, and that head is still so far forward that it's pulling your body when you walk, a lot of that has to do with, believe it or not, your ankles, your hips, your trunk. And people don't necessarily know about those body parts impacting posture. So well-meaning but misinformed healthcare professionals will have you stretching the chest and opening up the shoulders and pulling those shoulders back and pulling that head back. And if the ankles are not dorsiflexing properly, you're going to lean forward. If the hips are locked short in the front, you're going to lean forward. If your anterior chain or the front of your body is weak, you're going to lean forward because your brain doesn't want you to fall back and smack your head open. So it won't let you stand up straight because you're too weak to do so. So there are so many things that can improve this, but you have to work with somebody who knows, or you have to be informed of this. So what was your answer to that question? And then the last one, number 7. Do you leak a little when you sneeze or cough? Yes or no? Do you feel like you have to rush to the bathroom when you get the urge to go, or you're going to have an accident if you don't get there quick? That's another issue. That's urge incontinence. And, leaking a little when you sneeze or cough is stress incontinence. I've been teaching people how to resolve this for years. Standing up on their feet, fully clothed, doing exercises to engage the hip rotators and strengthen the levator ani, which is the muscle that supports a full bladder and helps to keep the sphincter closed until you decide to allow it to open. So lots can be done. This does not have to be your future. So, what's your risk of losing your independence? Most people really fear becoming a burden to family and causing stress to loved ones. A lot of people fear that physical decline and loss of mobility. Are you one of them? Are you fearful of weakness, pain, or inability to be active or exercise? Do you have chronic pain, discomfort in joints, and a fear that pain will worsen or become unmanageable over time? Loss of quality of life, that fear of existing but not living. And then, of course, it's extremely expensive to make sure that you can afford care, treatments, or maintain independence at home. Yes, what's your risk? It's so important that you answer those 7 questions with a yes. I really want you to get 7 yeses so that you can have lifelong well-being. It's what I teach. It's my passion. Please let me know. If you need any help, any guidance, contact me. Watch the YouTube videos. I do lots of free online events. I've got free memberships in different programs. This is what I live to do. I really want you to get 7 yeses so that you can have lifelong well-being. I'll see you next week.